The time now is 27 minutes to 8. Many people were moved when they heard an MP tell the House of Commons about her mother, who'd just been diagnosed with dementia. Liz Saville Roberts said she was afraid she wouldn't be able to visit her care home, a concern she says other families are having.
John's campaign has successfully campaigned in every UK nation that people disabled by dementia have a special need for person-centred care, and that under the Equality Act 2010. But in reality, there remain many care homes and hospitals where even the most minimal visits can be denied, leading to isolation and separation, which cause irreversible damage to well-being.
Well, the current rules are that care homes have to quarantine if they have an outbreak, and that's when 2 or more staff or people living in the care home test positive. Well, we are joined now, first of all, by Liz Saville Roberts, the MP we heard there, Westminster leader for Plaid Cymru. Good morning.
Good morning, Bore da, Martha.
Bore da, I'm so sorry to hear about your mother. And visits, as anybody who knows who has a relative with dementia, are incredibly important, aren't they?
Well, they are. And I think one of the important figures that was brought home to me is the understanding the week before I was able to spend some time in hospital with my mother, that there were 144 deaths in care homes in Wales, and 3 of them were from COVID. So while, of course, everybody wants to take the best care and look after our care home residents, we have to actually look at what are we protecting them from here. We really know that isolation and separation affect health and well-being. They can reduce lives, and it can bring misery to people at the end of their lives without even considering their families. And I think their families deserve to be considered as well. So while understanding the caution and knowing that we've had to deal with a novel illness, COVID was unfamiliar 2 years ago, but we're now 2 years into it. And of course, you were talking earlier on about the 200 army personnel going into hospitals around London and the southeast of England. Well, 160 of those, I understand, don't have medical training. And yet we have volunteer carers waiting in the wings, willing to come forward as essential caregivers, to which they have a right in law.
Well, that's very. They do have a right, and that's a very interesting point, isn't it? But isn't it the case that the new rules say that people who are designated as essential caregivers are allowed into care homes?
They are allowed in law. If you look at the Equality Act, Human Rights Act, even the Mental Capacity Act, which of course apply across all the nations of the United Kingdom, but there is a gaping chasm between legislation and policy and what is actually happening on the ground. And of course, to be fair, this is mostly guidance.
And so the care homes are over-interpreting in your view. And what is all of this meaning for you? What is all of this meaning for you? I mean, do you fear that you actually won't be able to see your mother?
Well, that at present is what I fear. I was able, of course, to go in on the last day of the last year and spend 3 hours with my mother in hospital, and I'm immensely grateful for that. And of course, what I did, and which I think any family member in this position would jump at the opportunity. I took a lateral flow test. That was negative. I would do that every day. And that, therefore, in many ways means that I abided by all the requirements of what I was supposed to wear as PPE. But surely we should be looking to make best use. Volunteer carers are not visitors. The fact that they're voluntary and they're not being paid, surely now more than ever we should be looking at not just the fact that this is better for family links and better for people with dementia, and better for the families as well. But we've actually got a resource here that we're not using. Yes, and that we need to overcome that reluctance.
Well, stay with us, but I want to bring in our next guest now, Jeremy Richardson, who's Chief Executive of Four Seasons Healthcare. Good morning.
Good morning.
And we heard from Liz the sense that deaths in care homes, however, obviously incredibly unfortunate, but far fewer are now being caused by COVID. Is that what you're experiencing in the places that you run?
Yes, it is. And I'm going to listen very carefully to what Liz said. And I have huge sympathy with her plight. And I agree with her almost wholeheartedly. I mean, if I look at our data, we've had 2,320 deaths since the 1st of March last year. And to give you context, that in itself is below the 4-year average number of deaths. So our total number of deaths is below the average. And of those, only 27 came from COVID. So that's 1.2%. And in the last 2 weeks, we've had 132 deaths, again below the 4-year average, and only one of those was from COVID.
Now, what the Prime Minister has said in response to these kind of concerns is we do have to try to strike a balance and to keep care homes residents safe and do what we can to prevent the epidemic from taking hold in care homes. And of course, we all remember what happened at the very beginning of all of this.
Yeah, well, with respect, I completely disagree with the Prime Minister because I don't think he is properly balancing the risk. 2 years ago, and Liz made this point when she spoke just a few moments ago, 2 years ago, the consequence of transmission was at best uncertain. Right now, 2 years on, we know very much more about the virus and the consequence of transmission has changed dramatically. So we are seeing outbreaks of COVID in our care homes, but the outbreaks are very different to what they were doing 2 years ago. We're seeing flare-ups, they're then dying away. Most people are becoming only very marginally ill. Very little is leading to serious illness, and very few people, as I've just said to you, are dying. So I think we have to look at what COVID is doing with proportionality and context, and I don't think the government are doing that. The virus has evolved, but I don't think the government response has.
And finally, Liz, you said after your very moving speech in the Commons, a number of relatives contacted you. What kind of things have they been saying to you?
So as you can imagine, you hear over and over again that people have missed. They feel that something medical has happened. In the case of my mother, it was a stroke. This happened a year ago. It's only recently that she had the diagnosis of dementia. But that feeling that their family member went into hospital, that there were the critical few weeks there, and during that time they lost that family member. And in their heart of hearts, they're feeling, what could I have done? They're feeling the guilt. What could we have been able to do to maintain contact with that person? And they know that they've lost it. Now, a year ago, exactly as Jeremy said, we were not in the position that we are now with vaccinations and boosters. Okay. But as we move ahead, we know that this isolation and separation, that in itself prevents keeping people safe, because that isolation and separation has an effect on elderly patients particularly. Cognitive impairment, dementia sets in for the first time. We have, and you were talking, your story earlier on was talking about a rise of 3/4 of people living with dementia. I must say, my mother, she never smoked, she hardly drank, she kept herself healthy, and yet dementia is what she's experiencing at the end of her life. This is what is facing most of us, the vast majority of us, at the end of our life. We really need to think about how we handle this within our health and care settings. And in the immediate time and the here and now, of course, we could use volunteer carers. But in future, this recognition that separation and the loss of family bonds is damaging and we need to stop it.
Liz Saville Roberts, thank you very much indeed for talking to us and wish you all the best for your mother.
It is now 19 minutes to 8. Let's take another look at what's